Mark. After all, there have been 8 overdose deaths in Erie County since Saturday alone. Those numbers have us taking a much closer look tonight at not just the problem, but how this problem all began.
In order to do that, we turn to senior correspondent Rich Kellman. His investigation goes back over a year, and he found 2 issues: opioids and pain management.
The arrest last year of Dr. Eugene Gossi forced many of us to confront a contradiction. His many patients depended on him for relief from debilitating pain.
He was the one that was giving me the medicines so that I could live a decent life.
The patients at Dr. Gossi's practice are really suffering
from my severe back pain.
Some days the waiting rooms there look like victims from an airplane crash all gathered together.
And now I don't know what I'm going to do.
And yet Eugene Gossi was charged with exploiting those patients for his own profit.
He really, in this case, was just like a drug trafficker.
In other words, acting like a drug dealer.
Running a modern-day version of a 19th century opium den for blood money.
Without medical reason to prescribe these drugs.
Retired surgeon Dr. Joseph Cardamone of Eden says that doesn't sound like the Dr. Gossi he knows. He referred his patients to Eugene Gossi, and he says Gossi showed strict adherence to opioid regulations.
If they came in and if they were taking other medication or they had other drugs in their system than what he prescribed, they were basically out of his practice, so they knew that.
He was a good man.
I think he was. I think he still is.
The case has been a wake-up call over the past year about opioids, addiction, and what comes after. We are in the midst of the worst drug overdose epidemic in American history. You said that.
I did. I did say that. You kind of hope to see the trend reversing, and of course the trend has done nothing but go up.
The main drivers of drug overdose deaths are opioids, according to the CDC, pain meds, the synthetic drug fentanyl, and heroin among them. An estimated 33,000 deaths in 2015, more than the total number of gun homicides and traffic deaths combined. In Erie County, Health Commissioner Dr. Gail Burstein is still calculating last year's numbers.
Confirmed and suspected opioid deaths in Erie County, a sharp increase. 2016 and then 2017, averaging about 1 suspected overdose death a day. So it's really awful.
In late March, just 6 weeks ago, Daniel Adamczak of Cheektowaga died of a heroin overdose. For 7 years, he struggled with pain from an accident. He was prescribed opioids, had his good times and bad, but finally turned to heroin.
Heroin is everywhere.
Danny's mother, Christine.
And once it gets into the point where you cannot control it and your brain takes over telling you you need it, you need it, you need it, you will do anything to get it.
And you can get it cheaper on the streets than medication, but often with an added kick. The drug fentanyl, dozens of times more powerful than heroin, this amount can kill a grown man. The addiction is tenacious. It will never let you go.
It won't, and that's the sad thing. It won't let you go.
Today, the pain clinic is back up and running. The new clinic director, Dr. James Hitt, aims to measure the risks and benefits of medication.
It's definitely going to be a focus of the future. What are the risks and how do you identify them when you're treating chronic pain patients in a medical setting? And what are the benefits that we're looking for?
He recently hired chiropractor Dr. Antonino Carlino to provide active care.
Active care meaning they're in PT, physical therapy, doing exercise rehab for their spine or their extremities. They're actually doing something and not sitting on a couch just taking a medication.
How this opioid addiction crisis began is a story that goes back 10 years.
10 years ago, we first started seeing the prescription painkillers come in, and we saw the first couple of deaths.
UB professor Dr. Hannah Grohl-Prokopchik has found there were few, if any, studies of the long-term use of opioid painkillers. In the long term, it could be very destructive.
Yes, and just in the last couple of years, we are seeing more and more research showing that there are long-term negative consequences of opioid use, even for people who are using the drugs exactly as prescribed.
We're expending a lot of money dealing with it.
Erie County has filed a lawsuit against drug makers it claims used aggressive marketing, minimizing the risks of what they were selling.
The drug companies sold and created these drugs and said they were safe alternative when in fact they knew they were not, and now we have created a nation of addicts.
Dr. Robert Milch helped reopen the Gosey Clinic last year. In this crisis, he sees an opportunity
as a community that will help bring us out of this darkness.
Bring together everyone, doctors, nurses, hospitals, insurance and drug companies, the medical school.
This will only be dealt with by a comprehensive approach. You cannot just bring a hammer down on any one practitioner and expect that you're addressing the issue.
We just have to embrace that we have this problem in our community, and we just have to beat the stigma and realize this is people that we love and respect in our community are struggling with this.
Alex Conley King.
The stories are heartbreaking, the numbers breathtaking. In 2 years nationwide, more deaths than the number of Americans who died in Vietnam. It is an American crisis. It is a Western New York crisis.
You know, this problem is in your backyard.
And so it is. Dr. Gosey returned to the pain practice with restrictions under court permission nearly a year ago to protect the safety of innocent patients, as the judge put it. By all accounts on both sides, Gosey's trial on more than 114 federal charges relating to his pain practice is likely to be a year away. Rich Kelman, Channel 2 News, on your side.
I'm Steve Brown. Getting into drug treatment or getting someone you love into drug treatment can be a frustrating experience. But in Erie County, a single phone call can lead to one meeting and placement in drug treatment, sometimes all in the same day. That story, Wednesday at 5:30.
Thank you, Steve.
Eye-opening reports.
Yeah, and we really appreciate Rich Kelman's long-form investigation. It really puts into perspective this crisis that we report on every day really didn't happen overnight.
That's right, and there is help available out there. That's what we want to make sure people know.
There is, so Steve's follow-up is an important one not to miss.
All right, we're going to go upstairs to Mr. Kevin O'Connell. He's got the nice spot up there. And,
yes, these are the